All right, thank you all for joining the HCM 340 live session. Before we get started today, just want to share with you that I've put a survey link in the chat box. Just want to make sure that you could see it. And once this is done, will you please complete the survey? My program director reviews them and just want to get feedback on the whole program and how things are going for you. So you have that in the link in the chat box. Do you all see that?
I do.
Before we get started with the actual lecture, these lectures, and did I say my name? I don't think I did I? I am Katina Flag, and I will be facilitating this live session today. Others are joining. I'll briefly turn my camera on so y'all can see that I'm a real person. I lost my mouse. Good morning. Guess we could wait another minute or so just to see if another person will join. But I am Katina Flag. I will be facilitating this live session. We actually host two sessions a term. It's just primarily so that you all know that someone is actually live and that we're here to support you. If you need assistance, not only can you reach out to me, but reach out to your instructor. Um, if you have questions about your assignments, make sure you reach out to your instructor as a resource, as well as we have the Shapiro Library. Make sure you use those resources as well. And if you are having difficulty with any assignment, you have all of those resources to support you. The one thing I want to say while we're just getting started is, when you are working on your assignments and your discussion responses, please make sure that they are in APA format. Um, we are, as an institution, looking at that. That's our model that we ask students to utilize when they're completing their homework is basically giving reference to the appropriate stakeholders that you've used to do your research. And every post or every um, paper or assignment that's completed, you should properly reference it because you have to do some type of research or read some kind of material to make an informed decision to complete your documents. Another thing I would like to say is when you have like final papers or any type of papers that you complete, include data and graphs to support, you know, your content, right? Industry standards gives us data, it gives us details. So they always say the devil is in the detail. You have a stronger paper when you have uh, the supporting content to build on your topic, right? So if you select a topic pertaining to military health care and their insurance plans, go out there to the va.gov or go wherever and pull some stats. What's the industry standard say? Talk about that catchment area and all of those sorts of things that give you support to build a strong um, discussion post, research paper, final project. Does that make sense to everyone?
Yes.
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 Awesome. Does anyone have questions about that?
I don't.
Have you all experienced any pain points in the course that you need like extra clarification or anything at this time?
I have not. Thank you.
Good, good. Okay, great. So that means that you guys are following the content well, which is amazing. Thank you for sharing that feedback. So we'll just The sessions are like 30 minutes. So I just want to give you guys opportunity to ask questions or give feedback or get clarification, but we'll just jump right into it. And as we jump into it, I'm going to turn my camera off. So if you have anything to say, I'm using one monitor right now. So please unmute your mics and just jump in and, get my attention because I won't be looking at the chat box. Okay. And I am going off camera now. It's still early in the morning for me. So, but this works. So this week, we're entering week 3, and you're going to be looking at the healthcare system performance, right? Which is an interesting topic this week with the state of our administration and with the things that's going on in politics and everything. So right now, when we start looking at healthcare system performance, the first thing I think about is, the global concept of how healthcare is getting funded and those sorts of things. But it's a really big holistic approach. When you look at healthcare, there are going to be many things that you all may already be working in healthcare, or as you move into this healthcare industry, things that you will experience that you would think is pretty interesting, right? So when you look like here, it tells us healthcare system performance. It says satisfactory performance is crucial to healthcare organizations and to the healthcare system as a whole. Basis of the confidence and support needed from individuals and institutions to survive and succeed. And when we think about that, when I think about that from a global perspective, um, as you all see, the current administration has changed a lot of our rules. Um, a lot of things are being modified. And one of the things that's significantly impacting healthcare as a whole is the funding for Medicaid, right? So a lot of organizations are heavily funded from that program. It's called a DPP program, and I can't remember the exact acronyms, but what that does is a lot of organizations accept patients on Medicaid and provide them quality health care and to get a reimbursement for those services. Well, because of the DEI and those sorts of things that's currently being analyzed and reviewed, those fundings are being shut down at a lot of organizations, which is forcing some organizations to possibly close their doors. You may hear a lot of organizations laying off. Have you all experienced that or heard anything about organizations laying off due to the widespread of resources? What has been your experience with this far?
I've heard a little bit about it, but I don't really know much about it.
Yeah. So in some healthcare organizations, it is impacting tremendously because there's an example of one organization that's really having to downshift. People in the industry are actually, they're already laying off some stakeholders because the fund stopped. So if the DEI initiatives were not signed in some organizations, and those organizations did not agree to remove their DEI, then their funding for that Medicaid population stopped. In some instances, that's $80 million, right? 80, 100 million, that's a large percentage of some organizations' funding, which then results in a bottom line of having only 30 days of revenue in the bank to pay their staff and run organizations, which then leads to layoffs. So it impacts the performance of a healthcare system globally, holistically. So a lot of organizations are shifting, making adjustments, trying to dig resources from under a rock, right? So when you start thinking about system performance, it's not just the bells and whistles of the system being in place, like a EHR. It's all of those inner workings, all of those contracts, all of those things that help an organization run. And when you are in these courses, these are some of the things that you get exposure to and help you understand, what the next building blocks are and understand how, everything, the inner workings drive a successful organization. Does that make sense?
It does.
Yes.
Are you all currently working in healthcare?
Yes,
Yes.
I am.
Yes, I am.
Front end, back
Yes.
end?
Back end for me, revenue cycle.
Okay. So you stakeholders in the rev cycle, I'm sure, have you not heard conversations from your leadership basically saying the pressure of what you guys need to do to get those claims out the door right now, or any impact that you're experiencing due to the Medicaid shutdown on payment of those Medicaid programs? Have you heard anything in your organization?
No, not necessarily like that, because we see it on the flip side. We only see our Medicaid patients obviously when we're in the hospital.
Mm-hmm.
But we do, when I say that, I shouldn't, we do have dual patients that are Medicare Advantage and they're dual. What we've noticed is the reduction in benefits for our patients with Medicaid. So a
Mm-hmm.
lot of people that were covered are no longer covered.
Right, right. And so
Right.
then, are you in the hospital side or are you on the
So
outpatient
I'm
side?
outpatient side, a cardiovascular, medium-sized practice. We have like 30, we have 30 providers in total, but we're under an umbrella. So we have a lot more than that overall, but we
Okay.
definitely see the impact of it for our patients.
Right. Okay. And see, because you're not a public funded hospital or something, you may
Right.
feel the impact. So you
Right.
may not feel it as large because you may have something, I'm just going to say like a Kaiser type of platform. And
Right.
they have a lot of third party payers like Blue Cross Blue Shield and those other sorts of payment. So you may not feel the burn as much as an organization, but organizations are taking huge hits, especially if their primary resource are from those populations of
I,
patients.
yeah, I can imagine. And I feel bad for the patients because the patients are losing coverage
Yeah.
too.
So you see it. You see the
Right.
direct impact. Yeah. And how does the organization, the performance of the organization, how could that sustain over time without proper funding?
Yeah, it would be very hard.
Exactly. Exactly. Thank you for chiming in. I appreciate
Yeah.
that collaboration.
Sure.
Appreciate that collaboration. So as you see, organizations are shifting and doing things they can, like go into electronic health records, putting processes in place so that they can sustain over time. And the whole goal is to give quality health care in a streamlined process, right? So that patients in, patients out, the claims in, claims out, everything is a united front, uniform, and it's in a systematic approach while being compliant. We don't know what we're going to see coming in the upcoming months as things are consistently being analyzed. um Things are consistently being signed into order, but as an organization, organizations must continue to provide the adequate performance, right? So, as a healthcare organization, it is essential for healthcare professionals to understand the assessment process, of an organization. So, here's an example. It says, first, healthcare professionals increasingly contribute in a big or small way to the performance of assessing and improving system performance. Well, when you see that, what do you think about how you as an individual touching the system, inputting data, have an impact? Will someone please mute your mic? Thank you. Okay, so you as an individual also, have a huge um, role in the success of an organization, right? It says, second, they are greatly affected by the results of assessing healthcare systems performance. whether providing direct care to the patient as a nurse, therapist, physician, or other clinician, or contributing to management of the healthcare organization, be it a hospital, nursing home, clinic, or other, their careers will be influenced by the assessment process. Over time, the insights gained from evaluating healthcare system performance drive change in professional roles, practices, and training. When you hear that, what do you think? When you hear that statement, that you as an individual have insight on evaluating the healthcare system, driving change in these professional roles and practices, how do you think you are a part of that process?
I'm not on the clinical side, but I think we're part of the process from on the revenue side, because I have coders. So I would say that making sure there's accurate data that's going out on the claim, um, that's also part of helping that process improvement. But I don't know from a clinical perspective.
No. And I think that's a perfect response. Oftentimes, everyone wants to do all of the emphasis on clinical, but without the revenue cycle, without HIM, without lab, I mean, well, let's just say the administrative part, HIM and the rev cycle, right? Without those two areas, coding, charge entry, ED chargers, PFS. Without that RAM of the organization, it will be a mute point because that's where the data flows. That's where the relationships with the insurance companies. If you find a kink in your claims and you're pushing claims out the door and you're not receiving payment, well, that's an opportunity for a system performance check, right? But is everything going out the door well and coming back in the door, then the organization makes money. If you do not have those systems in place, that's a barrier. So you have a very vital role in the performance of the organization as a whole. So that is a huge approach. The misconception is that the administrative staff, don't have value. Well, that's a huge misconception. We, on the administrative side, in every aspect, are the building block to the success of an organization. So I value you making that statement because that's, often a myth that people say, and it's so far from the truth. Do you not agree?
I just think there's a huge disconnect for the clinical versus admin side. And I think, especially in the practice I'm in, they've been there for such a long time. It's 50 years of service. There's been so many changes on the admin side, especially in revenue cycle. The physicians don't get it. They've been in the same EMR, so a lot is changing for them, and I think they will get it. But I agree with you.
Yeah. So are you guys on like Epic or ChartMax, or what type of
I,
system are you using?
I So we are looking right now at Athena, but what we were on an antiquated system. So a lot of the stuff that we do on the back end, it's a med informatics product, but what we do on the back end, we really know well because we had no options. We had to know it because it's very manual, which is great. I try to tell my team that's awesome because they're going to know a lot more than most people that are going into a really nice, robust system. But we should be on Athena within the next year.
Mm, sounds
So
like when I used to work at MD Anderson, we had a homegrown system, and it plays a big deal on system performance. And I'm glad you talked about that too, because it plays a big deal on your system performance. Like when you have a homegrown system or a very antiquated system, things break. You don't have anyone to offer support. You use more resources internally to make that a well-oiled machine. And right now, you need time is money. Every effort is money. You need to streamline those processes as much as possible. And back then, when I was at Anderson, they built that system, and it originally started from like a radiology platform. They needed something, and then it became the whole HI, the whole rev cycle, the whole organization system, everything in the organization was that. They used so many resources to keep it and maintain it. And so then they decided to go with Epic, which was a huge win for that organization. But this is the same thing, like you said. Right now, they're doing system performance assessments and they're switching to a more robust system, and that vendor will offer support. So, that vendor support to keep those patches in place, to keep those updates in place, and all of the man hours and revenue spent comes from that organization, right? It doesn't come from the hospital or the company or the entity where you're gainfully employed. I think that was a good point too. Thank you for sharing that. That was some good insight there. Those physicians often resist change because, like you say, it's a habit, creature habit. They're creature habits. They come in, they're used to doing everything the same way. Now you're asking me to do all of these clicks, but not knowing that these clicks are going to save you a whole lot more time. You could put dot phrases in those documents to make your electronic documentation faster, smoother, cleaner, and not mention legible. Oh my God. The legibility piece is another performance, a system performance mechanism that makes the world go round, because if you can't understand that stuff, how is the coders going to code it? If it's written so poorly and they're still documenting, they can't make out what's happening with the patient. The ease of finding physician orders in the patient's documentation, the charts, and all of those sorts of things makes it so much easier. So, in moving into that, it was talking about the criteria, right? The three evaluation criteria for healthcare systems are quality, equity, and efficiency. And I think in our conversation, we just touched on all of those. What do you think?
Agreed.
From being an end user, when you think about quality, what aspects are you thinking about from a system or a product holistically? Being that you touch the system, quality outcomes, bringing out a good product. Just for example, you guys are going through Athena. What do you like to see in that product versus what you have today?
Oh, everything. Just the documents alone, compliance. There's no compliance. So when we have chart audits, the way that our data pools currently impacts the results of our chart audits with payers. And they're looking at Medicare Advantages, and they're really have those under scrutiny. So I would just say compliance and accuracy, details that are not available in the system we currently have.
What about denials? How are you guys handling denials from a workflow perspective?
So we scrub. I mean, my team has to spend a lot of time because it's manual. Um, so they are having to do that on the manual side. So the scrubbing of the claims
Mm-hmm.
needs to improve.
Yeah. What about crossover claims? How challenging are those?
Those are actually not too bad in our system. Those have, because Medicare handles a lot of that automatically for a lot of the patients. So that's not necessarily as much of an issue for us, but just the lack of detail, I would say,
Mm-hmm.
that's required versus what was required, 50 years ago, 40 years ago.
Great point. So you see how we just dialogued, and team, you all can jump in at any time. But we talked about quality, equity, and efficiency all in that one conversation, because you touch all of those. So having a solid system in place so that the performance, overall performance is solid, you see the impact, because it's a delay in revenue, it's a delay in patient care. If you're checking a patient in at the front and two people can't be in that chart at the same time, then you have to wait for someone to close the chart to open it on the back end. That could be, time consuming. It could be wasting time because you can't move forward in your next process. But the ability to have an EHR where stakeholders can actually be in the chart, two people at one time, that increases efficiency. the ability to input data and get it out in a clean, reportable platform. That's the equity and efficiency of the program. So it's a benefit to having these products and understanding how the organizations flow, and overall, from a performance mechanism, it has a lot of weight. Okay, so it's been good to kind of dive in and just talk about from a real in perspective, because you are one of the stakeholders that's actually digging down in the weeds, and you see the importance of having a good quality system and having a leadership to support the change mechanism. What's more importantly too is if you don't have everyone else buy in, like for instance going through an EHR upgrade or any type of major change. If you work in the hospital and you need to get, just say you have this EHR system, and then radiology needs to patch in and bring in another system, or uh, oncology need to patch in. All three of those products have to work. So generally, having leadership buy-in is important to make sure that the systems are performing well. And not only that, you have to have a strong IT department to sustain. Because once all of these things are put in place, the patches and the maintenance of it is so important. So when you look at it, it's not just the financial aspect. You have policies and procedures. You touched a lot on compliance, having the ability to make sure that everything is up to code, meeting the IT criteria, meeting the governmental regulations. So having that whole well-oiled machine is very important, that all of those pieces are viewed and analyzed when making critical changes and running an organization efficiently. Any questions, comments, or concerns about that?
No,
No, thank you. Okay, so we're approaching the end of this. It's only 30-minute sessions. I do have a session after this, so I need to wrap up for the other one. But just wanted to know, do you have any questions, comments, or concerns, or did you guys find this information helpful?
I actually did find it very helpful because I was actually unaware that Medicaid was stopping funding. I do prior authorization for a cardiology clinic, but I had no idea about the Medicaid, so that was actually very informative on that part.
Well, thank you. Thank you, Sarah, for sharing that. Yeah, it's a lot of things changing. You may just want to keep your ear to the street with the current administration and just follow the whole DEI thing. It's all that revenue reimbursement impact is coming from the DEI. So if a lot of organizations are changing or removing the DEI component, their revenues are being withheld. Um, so yeah, it's more to come. Things are in administration. So just keep your ears to the street. A lot of things are impacting healthcare and other organizations and benefits as well as they streamline. You know, it's called the Doge Department of Governmental Efficiency. Yeah, a lot of things are coming out of there. So more to come to that. But I want to say, guys, thank you all for joining this live session and dialoguing. It was great to hear some of your voices. And we will have another one, I think it's in 2 weeks. And so if you want to join us back, look forward to seeing you then. Thank you. And don't forget the survey. The survey link has been placed in the chat box.
Okay, thank you.
Thank you. Y'all have a
Thank
great
you.
day.
thank you.
Thank you. See y'all later.
Thank you.
All right. Bye.
Thank you.